Welcome to the University of Colorado Department of Otolaryngology Head and Neck Surgery. I appreciate your interest in our programs. I want to take a few moments to introduce you to our rhinology group and programs, our programs in endoscopic sinus surgery and skull-base surgery. I'll start by introducing myself briefly. I joined the faculty in 2002. I'm currently professor and vice chair of clinical affairs and quality. I also stepped into the interim chair role in February of 2022. I have a joint appointment in the Department of Ophthalmology, and of course, I am the senior member of a wonderful group of rhinology faculty committed to training, education, clinical service, and high-quality patient care. Currently, our group consists of 5 faculty members. Dr. Ann Getz joined us in 2013 after fellowship training at Stanford University, followed by several years on faculty at Washington University in St. Louis. We were very fortunate to recruit her to Denver. She's currently an associate program director, and she's leading our wellness and well-being programs in the department. Ash Conwalker joined us in April of 2022 after his fellowship training, also at Stanford University. Ash has hit the ground running, augmenting our programs in clinical research, skull-base surgery, and inflammatory sinus disease. You'll hear from both of them shortly. We are also fortunate to have 2 physician assistants as a part of our team. Robbie Gray has been with us 14 years and primarily focuses her activities on the Anschutz Medical Campus. Cami Collins spends 100% of her time at the National Jewish Health location, where she works closely with Drs. Getz and Conwalker. They are incredible pieces of our group, not only delivering great patient care, but supporting our programs in research, scholarship, innovation, and training and education. I will now ask Drs. Getz and Conwalker to take a few moments to share their perspectives and to introduce themselves.
Hello, my name is Dr. Ann Getz, and I'm an associate professor in otolaryngology at the University of Colorado. I specialize in rhinology and endoscopic skull-base surgery, and I also serve as one of the associate program directors for the otolaryngology training program. As Dr. Kingdom mentioned, I completed my residency training at the University of Pennsylvania and then went on to do fellowship at Stanford University. I was then on faculty for several years at Washington University in St. Louis before having the pleasure of coming onto faculty here at the University of Colorado. It is my true pleasure today to speak with you virtually and tell you a little bit more about our clinical training program in rhinology. During your PGY3 and PGY4 years, you will complete rhinology-specific 4-week rotations. During this time, it will give you the opportunity to really have a concentrated exposure to learn about the evaluation and management of various rhinologic conditions and diseases, and also various skull-base pathologies. It will also allow you time to be in the operating room, honing your operative skills at these approaches as well. In addition to these dedicated rhinology rotations, you will also have additional exposure during the remaining years of your training while at University of Colorado, as well as additional rhinologic exposure while rotating at Denver Health, the VA, and at Children's Hospital. By the completion of your training, on average, you will have performed 120 endoscopic sinus surgeries, which is 2 times the ACGME goal for graduation and 3 times the minimum requirement. If anything, you will leave this program overtrained in rhinology, which we think is a good problem.
Hey there, my name is Ashok Conwalker. I also go by Ash. I'm currently the most junior member of the rhinology section in the Department of Otolaryngology at the University of Colorado, having joined as an assistant professor in April of 2022. By way of background, I attended college at Harvard and graduated with a degree in the social sciences before spending 2 years in the pharmaceutical consulting industry. I then went on to medical school at the University of Chicago, followed by residency in otolaryngology at Northwestern University, and finally a fellowship in sinus and skull-base surgery at Stanford University. It's been an honor for me to join the incredible group here at the University of Colorado. The section has a deep history as a key thought leader in the national and international rhinology landscape. And much of this starts with the exceptional research productivity that's available here. From the clinical side, you'll work alongside your faculty mentors and you'll have access to a fantastic group of research coordinators who can help you to implement your research ideas to answer questions of interest, whether in the area of inflammatory sinus disease, sinonasal tumors, or skull-base tumors. We were recently selected as a clinical trial site for a novel biologic medication in the treatment of nasal polyps, keeping us at the forefront of the latest innovations in our field. We also have collaborative research opportunities with our allergy, asthma, and pulmonology colleagues. On the basic science side, we have abundant opportunities for those interested in the T32 track. We have a particular strength with our basic science partnerships in the area of olfaction, which is a particular clinical interest of mine, in which I'm a clinical co-mentor. Aside from the research collaborations, we have plenty of opportunity for close clinical collaboration with our colleagues from across departments and specialties. We have a strong relationship with the neurosurgical faculty and residents in the skull-base program, and our residents have the opportunity to perform the approach for complex skull-base tumors, including pituitary adenomas, meningiomas, and chordomas, among others. We collaborate frequently with our oculoplastics colleagues to perform dacrocystorhinostomies and other orbital procedures. We work closely with our pulmonologists, allergists, and thoracic surgeons in the comprehensive lung and breathing program, which emphasizes the unified airway, which we help to compose. We also work closely with our medical and radiation oncology colleagues in the management of our oncology and cancer patients. These are just some of the examples of the collaborative clinical opportunities that you'll have in your residency, which will provide the foundation for your future practice. I believe that the rhinology section in particular is a key strength of the otolaryngology program here at the University of Colorado. You'll have mentors at every stage of their career who will be able to provide you with perspective, guidance, and advice as you proceed through your residency. These opportunities will be endless to hone your clinical acumen as well as your technical skills in the treatment of a wide variety of complex sinonasal pathology. Regardless of which area of otolaryngology you ultimately decide to pursue, you'll be extremely well trained in rhinology and comfortable in the clinical and surgical management of these patients.
Well, hopefully you can see we're proud of our programs in rhinology and what we can bring to the trainees, what we can provide to education and training and provide to our patients and the community. We do feel we're unique. We feel the 5 faculty members provide breadth and depth that is excellent and so important to training and clinical care, as well as our research and scholarship missions. We do over 5,000 outpatient visits per year, approximately 600 surgical cases. And as we think about our wonderful collaboration with our neurosurgery teams and our oculoplastics teams, we've done about 100 endoscopic skull-base cases and 50 endoscopic orbital cases over the last year. Those are unique features that we think differentiate us from many training opportunities in the country. Another aspect to think about is we're quite proud of our involvement and commitment to service on the national level, which provides opportunity for mentorship to our trainees and professional development to our trainees for those who really wish to pursue that line of training and development. At the University of Colorado, we are truly privileged to be able to offer state-of-the-art rhinologic and skull-base care, innovative research and scholarship, collaboration with multiple important clinical service lines and departments, and what I think is fabulous, broad, deep training that is second to none in this country. Our residents represent a diverse, talented, committed group that only make us better as faculty members and contributes to our culture within the department. I am quite certain you will leave our program well-trained, confident in what you're doing, and with doors open and options open for you to pursue various career opportunities as they align with your wishes and aspirations. Thank you for your interest, and I wish you all the luck.